Dr. Deonandan. Good morning.
Good morning. How are you?
Not too bad. How are you feeling?
Well, a little confused, a little scared, but we have to stay vigilant and be a little bit hopeful, I think.
Yeah, it definitely, you wake up this morning, I mentioned off the top of the show, feels like a little bit of a hangover, just trying to get a sense of what exactly happened yesterday. So maybe let's just start with these new restrictions announced finally late yesterday afternoon. I'm sure you were watching closely like all of us. What do you make of the new restrictions?
I'm disappointed. There is some good here, but there is also a missed opportunity. So let's go through them. There are some good. The good things are limiting non-essential travel, or at least restricting to some extent. That's great. It prevents spreading, especially of currently restricted variants like P1 from getting too well distributed throughout the province. The second is prolonging the stay-at-home order from 28 days to 2 weeks beyond that. That's going to be useful. Changing how we distribute vaccines to different postal codes, that's useful. But I was disappointed that there weren't more measures to protect essential workers. So they need priority access to vaccines. They need paid sick days. They need improved working conditions in terms of ventilation. We need to deploy our rapid testing capacity to keep those people up and working. And this strange fascination with outdoor recreation is mystifying to me. The third wave is not driven by outdoor activity, as far as I can see. And so, this putting yellow tape around playgrounds, I don't know what that accomplishes, except to make a lot of people angry and to create resentment towards public health. So, that's going to be interesting to see. And this new police powers, I don't know if policing is the solution here. I understand we have an issue with house parties and indoor gatherings that are untoward, and those probably should be better investigated by police. But the stop orders and powers that police now have, I'm not comfortable with that. So overall, hey, it's going to help. The new restrictions will help, but I don't think they're the most effective use of these powers.
And just to kind of break down, there's a lot to unpack there just with those four or five topics that you've mentioned. Let's start with the outdoor amenities because that's where we're seeing the most anger and backlash. As you mentioned, we've seen a lot of data and research that this wave is not being driven by outdoor transmission. We've seen that borne out in science. So why do you think that the government has focused on this? I guess we've talked a lot about the need for mental health supports in terms of being able to go outside, being able to visit some of these parks and things like that. So what exactly do you think that this does?
I'm trying to understand what prompted this decision, and I can only conclude that there are a couple of cases of people having outdoor parties and things like that, and they're few and far between, though. I think it was an easy target, and maybe someone was driving around and saw some kids playing basketball without having masks on or something like that. Oh, we can't have that. Let that happen. But that's not really the problem, is it? In fact, most of the time, if you go to a playground, the kids are separated. They're not touching each other. Many are wearing masks. It's more or less a safer environment than having them inside. I mean, we haven't restricted places of worship to any great extent, as far as I can see. So, on the one hand, our kids can't go play in the playground, but on the other hand, they're free to cluster in a church and pray together. I don't understand this logic.
Yeah,
So,
it's kind of bizarre. It was mentioned, Premier Ford said yesterday that he'd been driving around seeing parks that had been packed as part of the new restrictions. So that is part of the reasoning is basically, Premier says he's driving around, he sees these parks packed. But just as you mentioned, a lot of these playgrounds, it is kids. And I think like even with two stepkids of my own at home, we've drilled it into their head that they need to give space to everybody. They need to wear masks. So that's generally what I see happening. So I find it difficult to understand what exactly this accomplishes, other than, as you mentioned, making people more angry and upset with health officials.
right, who's going to take the brunt of this? It's local public health officials will take the
Yeah.
brunt of this anger. I think there's probably a middle ground to be reached here. Yes, we can have these gatherings of adults partying in parks. Send the bylaw officials to investigate those and to make sure people keep their distance, but make sure amenities are open for children. We have a lot of kids living in apartments and tenements who don't have the opportunity to have fresh air. That's got to be accommodated. So I expect they're going to roll back some of this and redeploy the assets accordingly in a couple of weeks when the feedback is received.
Yeah, and we've seen that feedback borne out for sure. And the problem parks here in Ottawa have been, Mooney's Bay. It's been adults more than anything else. But to kind of move on from that part, Just talking about essential workers, that was also something that was missing yesterday. You and others have been sounding the alarm for many weeks now about the need for essential workers to get protections, be it mobile vaccination clinics at warehouses, rapid testings deployed in the workplace, paid sick days. But we didn't see any of that yesterday. Do you see anything out of yesterday's restrictions that do more to protect essential workers?
Well, distributing vaccines to hotspot areas is
Right.
useful. Yeah, and those hotspot areas tend to be places where essential workers work. So that's going to be definitely useful. But if they are not eligible for those vaccines, that's not particularly useful. And if other people are ahead of the line, of them in the line, it's not useful either. So it'd be great if they were prioritized for accessing vaccines. This is a wartime endeavor, right? So during times of war, everyone who's not on the battlefield tightens our belts and we eat less and we send our food to the soldiers on the front line. Guess who's the soldiers on the front line? Our essential workers, the people working in the warehouses who keep us, well fed while we wait this out. So they deserve the stuff that we would otherwise get. In this case, vaccines, rapid tests, good PPE, and things like that. So it's not advanced thinking that leads us down this path. We can also look at the data and see where are the cases exploding. People who are middle-aged, a little bit younger, that's filling the ICU wards, and their families, right? So lower income people who cannot socially distance, who must go to work, who live in crowded settings, they're the ones who are the crisis in the hospital settings. So they're the ones who need our support. It's not rocket science. It's epidemiology.
Yeah, well, it seems frustrating to have the same conversations because we have been seeing some of this stuff continually, and then not kind of come to fruition at the end in terms of actions or restrictions. But just on the essential worker point, I guess, do we need to start thinking about eligibility by age as not being the way that we approach our vaccine rollout?
Yeah, that's eligibility by age was something I supported heavily when we weren't in a crisis mode, right? Because
Hmm.
you're hardening the people most likely to be hospitalized and die. And it makes sense. You've got some time, you've got some buffer space. But now that we're in crisis mode, meaning we've got days before our ICUs are overwrought, it makes sense to pour the water where the fire is hottest. When a forest fire is blazing, you have many strategies. You can pour it where the fire is, you can pour it where the fire is going to be, or you can pour it where you happen to be standing, which is the least tenable of the strategies. So when the fire is not entirely out of control, you can pour it where the fire is going to be. Right now, you got to pour it where the fire is. That means getting it to the people who are most likely to be infected right now. That is, of course, those who are younger, essential workers. So right now, it makes sense to do away with the age restrictions and focus on people most likely to be exposed. We can go back to the age strategy in a couple of weeks when the crisis is over. Well, more than a couple of weeks. But until then, I think it makes sense to keep our essential workers best protected.
And just in terms of the vaccination process, many have said, we can't vaccinate our way out of this. We're just to that point right now where it can't be done. I guess, are you comfortable with the current pace of the rollout? I guess we're around 100,000 a day here in Ontario. That's what the average has been going. Do you think that needs to increase, or do you think that is enough to kind of get us by?
It has to increase if we can, but we probably can't. So we make do with what we have. So it is too late to vaccinate a way out of this, meaning that we are going to scratch ICU capacity, if not exceed it, sometime soon. What we have to do is okay, so this is a supply and demand issue. We have a supply of healthcare facilities and resources, and we have a demand for them. We really can't increase the supply. Supply is really the rate limiting step is healthcare workers. Sure, we can make more beds, we can order more ventilators, but we need people to staff those beds and to manage those ventilators. So we can only expand that a tiny bit. Demand, on the other hand, this is where we can really apply our resources to diminish demand. That's about diminishing community transmission. Each of us has it in our power to diminish demand. So that's why the policy levers have to be focused more at that end. The vaccination part of it, well, that's the end game here. That's what we're trying. That is the goal of these endeavors, to buy us time to get vaccines into arms. So the more we can get and the faster we can deploy, then the shorter the time period we have to endure these restrictions. But I think everyone understands that, and it's a full court press to get more vaccinations. What's missing is the will of the citizenry to accept the vaccinations in some parts of the province, not everywhere. So we do have AstraZeneca shots being unused still. So people really should, go to their local pharmacies, and if they've got a supply, accept that shot. It will help enormously.
And good advice. Just in terms of the policing aspect, just a quick one for you. We could talk about this all day, but just on the policing aspect, does this not increase contacts between Ontarians? We're dealing with all these, possible spot checks, different checks between police. I understand there's PPE, but are we not increasing contacts the more that we do this?
That's an interesting point. I don't think that's a big issue. Police, for the most part, I think, are vaccinated and they are wearing PPE, and so they're less likely to be transmitting. So I don't expect to see any transmission events happening. I'm more concerned about the public sentiment and the mood and the morale this will cause, especially amongst those demographics who are already overly stopped and scrutinized by police. Right, certain
Definitely.
demographics in the province are already enduring that hardship, and this will probably increase that problem. So I don't see any positive outcomes of that particular part of these restrictions.
And we'll have to leave it there. But Dr. Deonandan, thanks so much for your time today. Again, always appreciated.
Thank you.